A warm good evening, everyone. It's a great Sunday today. It's the fourth day of the International E-Conclave. Very interesting day because on the last 4 days we have been, since the last 3 days we have been speaking about a lot of things about pharmacotherapy related to tobacco cessation. So, because now we are moving towards the panel discussion.
And let's have those brief but very critical remarks, gems of wisdom, experience, advice from a panel that I think I'm more than privileged to moderate. Dr. Swasticharan, we did hear initially, but Dr. Swasticharan, sir, especially about evolving consensus statement for tobacco treatment. If you have any ideas or advice, please.
Dr. Dimesh, can you please say it again? I couldn't hear it properly.
Okay, yeah, this panel we are trying to get gems from all of you experienced colleagues about treatment methods for tobacco and how we can arrive some uniformity or consensus about that.
Okay, I think I'll begin with this statement that we were struggling with the O component of the Empower WHO's Empower strategy, and we have come a long way, and that is offering tobacco cessation to the tobacco users. We try to deter people from initiating the use, and if by any chance they have taken up the habit, we are encouraging them to quit. And to do that, we have tried all means of reaching out to them. One of them is the quit line. Second one is the end cessation, and the opening of the tobacco cessation centers in the districts as per the National Tobacco Control Program. However, the districts are very large in India, and in these districts, if we have only one, we won't be able to cater to the whole population of the tobacco users in that particular district. In these tobacco cessation centers, I must emphasize here that the tobacco cessation, as we all know, is a very comprehensive matter. You have to combine counseling with some minimal nicotine replacement therapy. So that therapy component of the tobacco cessation in the form of nicotine gums has been made available with the nicotine gums, and some places they have also come up with the nicotine patches in these TCCs, is also to be a part of the comprehensive counseling of tobacco cessation offered by the TCCs in the district hospital. Now, as I said, if the number of TCC is very less in the district, I need to increase that number. So to do that, we had combined with the National Oral Health Program and the Dental Council of India, and we have come out with this mandate that every dental college in the country should open a tobacco cessation center. So thereby, the number of cessation has increased in the country. However, there will still be non-uniform spread of the tobacco cessation centers. In some states, like say in a small state like Puducherry, UT like Puducherry and other southern states, many of the dental colleges could be there. So you can have many tobacco cessation centers if you map them in some areas of the country, whereas it is not there where it is needed. So I need to increase the people who can counsel again, and so we have done this integration with the NCDs, and we are trying to make the NCD counselor also doing counseling for tobacco cessation, and also tying up with the tobacco, the DOT centers for the tuberculosis. So whenever a person drops in at a DOT center, we do ask about the TB symptoms, but we forget that TB person may also have a tobacco problem as well, because both of them are very closely linked. So we are trying to train the DOT center supervisors to also ask for the tobacco habit as well. And similarly, those people who are dropping at the tobacco cessation centers, we should also ask about the TB symptoms. So this integration we are trying to scale up in the country. And apart from this, the other thing which is coming up in the near future, which we are trying to reinforce again, is what is known as the screening at the doorstep by the ASHAs, which is known as there is a form called community-based assessment checklist. There, the ASHA comes at your doorstep, enumerates the members of the family, and those people who are 30 years and above, we try to ask for the risk factors as well as prevailing any NCD conditions. And out of those risk factors, we are asking them whether they are tobacco users as well. So once the person says, I use tobacco, and if his phone number is there, in future, we are thinking to link technology in such a way that, somebody, if he has uttered that he used tobacco, that number needs to be linked with the quit line. And we need to increase the quality of the quit line, the quantity of calls which can be catered to at the quit line centers. These are all challenges, but we are happy that we are inching towards that, and it's a race against time, I know that, but with all the challenges, I'm hopeful that India would one day be one of the leaders in offering tobacco cessation as a whole, sir. This is my remarks at this point of time. Over to you, sir.
Thank you. Thank you so much, Dr. Swasticharan. That the very useful pieces of information.